So, first of all, I'd like to ask you permission to use this video for educational purpose and on internet.
Yes, you may.
Tell me just what you just told me after the injection.
Well, it didn't work right away at the beginning, but I started to feel better, and I started to stand up straighter and walk straighter.
Mm-hmm.
And even the following week, I really hadn't told any of my friends my girlfriends about the injection, and I hadn't been anywhere. But when I went to church, my girlfriend had commented that I was walking straighter.
Excellent.
And so as I started to feel better, I had to record my numbers. And when I got down to the last couple days, I was almost afraid to write a 3 because I was scared that it was, I
You
knew
jinxed
maybe it
it,
wasn't
huh?
going to happen. And I go, if I write it down, it might jinx it, right? And I
Yeah.
didn't have a clue of why it wasn't going to.
What kind of injection did we do?
We did injection for the nerve block in the lower, but yeah.
Sacroiliac joint. We
Yeah.
did the injection here.
Yeah.
Do you remember why we did the injection in this area, in the sacroiliac joint?
Yeah, I think it was something about it separating on
Yeah.
both sides.
Yeah.
And,
To find
I had,
out.
years ago when we talked about this a little bit, I was sitting on the floor and played with my dog on the floor,
Mm-hmm.
but I couldn't sit there very long. It hurt so bad in my rear end, and I go, I can't play with him on the floor anymore. And that was exactly what was going on. But there was so much other things wrong with my back at that time. Those needed to be fixed so I could identify the pain better.
And so the idea of this injection is to see if the pain is coming from this joint and this joint versus spine, because lots of things can cause pain.
Right.
But if we numb it up and pain goes away, pain is coming from here. If we numb this up, pain doesn't go away, then pain is not coming from there.
It
No.
went away.
So the pain is coming from there. That's good news.
It wasn't good news when it went away, and all of a sudden I was back to walking funny and not feeling so good and hurting, but it was awesome. I was in unbelievable disbelief that I was doing that well, and I told my husband, I go, if this is what it's going to be, we need to fix this, because
Okay.
I went from old lady walking to upright regular walking, and I could feel that it was all along. I felt like there was something missing in my base of my body, like I couldn't straighten up right, and I could straighten up and walk right.
Excellent. Now, who did the injection for you?
A lady doctor with a nice
Dr.
brain.
Aya?
Yeah, Dr. Anya.
Aya?
Yeah, Aya.
So did she do a good job?
Very good job.
Excellent. She will be happy to hear that.
Yes.
And this injection was positive. We are on the right track. So we most likely will be able to help it and fix it.
Okay,
But
good.
thank you so much for the interview. I
Yeah.
appreciate it.